Great. Thank you so much for having me today and for that introduction. As Angela said, my name is Bridget and I'm an epidemiologist at the BCCDC, where I have the pleasure of working quite closely with her. Now, you may not know this, but November is actually Radon Action Month in Canada. So today I'm going to be quite fittingly presenting a summary of an evaluation of the British Columbia Radon Data Repository we've been working on for the past year or so. So I'd like to start by acknowledging that I'm joining today from the traditional, ancestral, and unceded lands of the Coast Salish people, including the Musqueam, Squamish, and Tsleil-Waututh First Nations, and that the data that I'll be talking about today was collected from across the province colonially known as British Columbia, all of which has been occupied and stewarded by Indigenous peoples since time immemorial. Radon affects people differently, depending on both the physical and built environments that they live, work, and spend time in. And we recognize that the ongoing impacts of colonialism and systemic racism mean that Indigenous communities may face a greater burden of not only radon exposure, but other environmental contaminants as well, despite not being inherently more vulnerable. We commit to continuing to learn, to listen, and to seek out ways to support Indigenous voices and Indigenous health equity, both in this project and in our work more broadly. Okay, so to be fully transparent with you all, my background is in infectious disease epidemiology, and so I had very little knowledge of radon before I started working on this project a year ago. In fact, I think I'd only ever heard about it from this one episode of The Office. So I thought we could kick things off today with a couple of quick polls just to see what your radon knowledge is coming into this. And I know this is an environmental health program, so I'm fully prepared for all of you to be a lot more informed than I was. So first off, take a minute to reflect on how familiar you are with radon right now. A, you have no idea what radon is. B, you've only heard about radon thanks to The Office, like me. C, you've heard of radon from other sources and you know the basics. Or D, you've worked in the radon sphere before and you know a lot about radon. So lots of results coming in. I see that there seems to be a lot of knowledge in the room already, which is really great. I'm happy to know that I'm not the only one who gets their information from TV, so thank you to the one person that chose answer B. We can continue on. Okay, so for our next question, what is the primary source of radon in homes? Is it A, the materials a home is built with, B, the groundwater, C, the soil and rocks beneath the home, D, the air outdoors, E, gas appliances, or F, all of the above? Okay, great. So I see that the vast majority of people are choosing soil and rock beneath the foundation, and that is the correct answer. Radon comes from uranium, which is a naturally occurring element, and it's abundant in Earth's crust. So the radon that we get in our homes is primarily coming from that soil and rock. Okay, and for our final question, who should test their home for radon? Is it A, people living in older houses, B, people living in areas that are known to have high radon, C, people who smoke or have lung conditions, or D, everyone? You see, we have a bit of a mix here between people who think it should be those living in high radon areas and everyone. And I will say the correct answer is D. While people living in areas where radon is known to be high or who have risk factors like smoking are at higher risk, everyone should test their homes for radon. And we'll get into why that is in just a minute. Okay, so thanks everyone for your participation in the polls. It looks like a lot of you have a pretty good baseline knowledge of radon already, but I thought I would start with just a little bit of background before getting into the evaluation to make sure that we are all on the same page. So radon is a carcinogenic radioactive gas that forms naturally in the environment when uranium in soil and rock breaks down. Radon poses minimal threat in outdoor air, where it quickly dilates, but in enclosed indoor spaces, such as homes, schools, or workplaces, it can accumulate to really high levels over time, and prolonged exposure can lead to serious health issues. Specifically, radon has been identified as the leading cause of lung cancer in non-smokers globally and the second leading cause in smokers. To reduce this risk, Health Canada recommends remediating any homes where indoor radon levels exceed a threshold of 200 becquerels per meter cubed. However, since radon is an invisible gas, it's completely colorless, odorless, and tasteless, the only way to know if you have it in your home is to test for it. So the causal link between radon exposure and lung cancer has been established since around the 1950s, when multiple occupational studies of uranium miners demonstrated that long-term exposure to radon gas significantly increased the risk of lung cancer in both smokers and non-smokers. And this led to the International Agency for Research on Cancer classifying radon as a human carcinogen in 1988. And since then, pooled analyses have extended these findings to residential settings and to the general population as well, and have shown that even low levels of radon in homes can contribute to lung cancer. And this is because when radon gas is inhaled, radioactive particles lodge in the lungs and release alpha radiation that can damage the DNA in lung cells. Even a single particle can cause significant cell damage, which means that there's no level of radon that's considered risk-free. That said, the dose-response relationship is thought to be linear, so higher radon exposure means higher risk of lung cancer. And the World Health Organization estimates that this risk increases by about 16% for every 100 becquerels per meter cubed increase in indoor radon concentration. Now, I mentioned before that the threshold for remediation that has been set by Health Canada is 200 becquerels per meter cubed. And this represents a balance between the risk of exposure and the cost and feasibility of reducing radon. But it doesn't mean that once your home drops to 199, the risk goes away. Because of that, we always recommend people reduce their indoor radon concentration to the lowest achievable level. And it's particularly important for smokers, since smoking and radon exposure act together to increase the risk of lung cancer. In Canada, radon is considered the second most significant environmental cause of cancer after UV radiation, and the most significant when it comes to lung cancer. This figure on the slide was produced by Public Health Ontario using Ontario numbers, but I think it does a really great job of illustrating the impact that radon has in terms of cancer burden, more so than a lot of other known carcinogens like asbestos and arsenic. Across all of Canada, 16% of lung cancer deaths are thought to be attributable to radon, which equates to about 3,000 deaths each year. So this is not a small number. As I mentioned before, radon is not really an issue outside because it's so diluted. It typically ranges from about 5 to 15 becquerels per meter cubed, so well below the threshold. It's when it gets into a building that it starts causing problems. So radon can enter indoor settings through cracks, drains, window casements, or basically any opening that's in contact with the ground. And it can build up to really high levels over time, particularly in basements and lower levels of the building. Remediation efforts often focus on addressing these routes of entry, for example, by sealing any cracks and openings, or by installing a depressurization system that vents radon from the lower levels of the home up and outside. Radon testing is relatively easy and inexpensive and can be done using a self-test kit or by hiring a certified radon measurement professional. Unfortunately, radon awareness and testing in Canada does remain low, and a 2021 study by StatsCan revealed that only 56% of households across the country had heard of radon. Of these, 69% could choose the correct definition from a provided list, but just 9% of non-apartment households had actually tested for it. Health Canada conducted a national survey of radon in homes between 2009 and 2011 to estimate the proportion of the population that were living in homes with radon concentrations above the 200 becquerel per meter cubed remediation guideline. And they found that approximately 7% of Canadians had indoor radon levels over that threshold, and that there was substantial variation across the country, with higher proportions observed in New Brunswick, Manitoba, Saskatchewan, the Yukon, and parts of BC. This variation across space is due to a couple of factors. The first is the underlying geology of the region. While radon is found everywhere in Canada, it's most prevalent in areas with large uranium deposits in the ground. The figure on the right here was produced by Radon Environmental, and it maps what we call radon potential based on the geology. So darker colors indicating more geologic radon potential, or a higher likelihood of being exposed to radon. You can see that there's a lot of variation in BC. The southeast and the north in particular have quite high radon potential, but there are also pockets and ribbons throughout the province. Along with geology, radon levels are also influenced by building characteristics. So things like the age of the building, the type of foundation, the size of the footprint, design features, and probably most importantly, the ventilation and air tightness of the home. There's been a bit of a push recently to increase energy efficiency by tightening up our homes, and this can inadvertently lead to radon gases getting trapped, which increases our exposure. And then finally, behavioral factors can also influence radon exposure. So how someone uses their home, do they keep the windows open? Do they spend a lot of time in the basement? That sort of thing. Because of all these factors, indoor radon can differ from home to home, even within neighborhoods with similar geologic features. So you really can't rely on your neighbor's test results to assess your own risk. And a recent update to the previous national survey on homes really reinforces that, I think. The study was released last year and incorporated radon measurement data that had been collected since the initial survey. This time it was found that nearly 18% of homes exceeded the radon threshold, which is a big jump from the 7% in the first survey. And part of this might be due to slightly different methodologies. For example, the new study looked at a greater variety of housing types. However, it's also hypothesized that building characteristics might play a role, particularly since newer houses tend to be poor quality construction and might be more likely to develop cracks as a result. And because they're also typically more energy efficient, which, as I mentioned, can lead to radon gases getting trapped inside. And I know a lot of what I've talked about so far has been focused on residential radon, but since this is an OEH seminar, I did want to quickly mention that radon is not restricted to our homes, and we can be exposed in other settings as well, including our workplaces. Obviously, workers in professions like mining and construction are at high risk, but a recent study by Carrick's Canada also identified significant exposure in workers in the educational, scientific, and healthcare industries as well. And these workers might be less aware of their exposure and are less protected under the existing guidelines. And that's because while BC's occupational health and safety regulation has an established limit for ionizing radiation exposure, radon gas is treated as natural background radiation, so it's not explicitly covered by these guidelines. WorkSafe BC does suggest that businesses in radon-prone areas consider testing, but there's no clearly stated requirement to do so. Questions surrounding employers' obligations to address radon are further complicated by changing work patterns since the pandemic, particularly the rise of work from home, since in a lot of cases, people's homes have now also become their workplaces. Some recent work out of the University of Calgary has been exploring these topics and has found that the increased amount of time spent at home during the pandemic was associated with increased annual radon exposure. And this is expected to continue as work from home policies persist. So this is something that will likely continue to be brought up in these occupational exposure conversations going forward. Okay, so we've established that there is a lot of spatial variability when it comes to radon, and this makes it difficult to approach from a public health standpoint. How do we know where to focus our time and efforts and resources? How do we communicate the risk to the public? Radon surveillance in Canada is not standardized, and while there is a lot of radon measurement data out there, it's all held separately by the industry professionals or researchers or government agencies who collected it, making it difficult to get a sense of the big picture of what's going on. The BCCDC established the British Columbia Radon Data Repository, or the BCRDR, in 2019 to bring all of those pieces together and reduce some of the data gaps for the province of BC. The BCRDR integrates disparate indoor radon measurement data from data holders across the province into a single system to facilitate radon research, inform risk assessment, and drive public health action. To support these objectives, the data are also used to conduct ecological mapping through the BC Radon Map webpage, shown on the right of the slide here. And this allows for the visualization of spatial variation in residential radon at the local scale. So I'm just going to spend a minute on the BC Radon map so that you get a sense of how it works. When you first launch the map, you're met with this pop-up, which has some information about the map itself and how to use it, as well as some of the data caveats to keep in mind. Closing this, you can then explore the map. You can select which indicator to display on the map, either the proportion of homes tested that are above Canada's remediation threshold of 200 becquerels per meter cubed, or the 95th percentile of measurements. And then you can select the geographic level that you'd like to see the data at. So there's quite a few options of different granularity. You can zoom in and then find your community and click on the map. And this will bring you to a pop-up which has more information about radon levels in that area. So where I live in Vancouver, less than 1% of houses that have been tested were above the remediation threshold, which seems low, but as we learned earlier, radon levels can vary a lot from home to home, even within the same neighborhood. So I should still be getting my home tested to make sure that I'm not at risk. Scrolling down, you find a table with some information about your risk of lung cancer, depending on your radon level, and how that risk multiplies if you're a smoker. And then at the bottom of the page, there's a link to the BCCDC's radon page to learn more. So I encourage all of you to check out the map later, play around with the different features, and see what radon measurements look like in your areas. So this figure illustrates the data flow of the BCRDR. It begins when testing is initiated, which can be driven by the sale of a home, recent renovations or construction, or simply just increased awareness about radon. Once initiated, testing is conducted by a certified radon measurement professional or using a self-test kit, preferably over a period of at least 90 days and during the winter months when the house is sealed up, just to make sure you get an accurate reading. The test results are then submitted to the BCCDC. Currently, we have 20 data holders from across the province voluntarily contributing their test results to the system, and they send in their data once a year by email usually. Once received, the staff at the BCCDC clean and anonymize the submitted data and collate it into the provincial repository, which includes information on geographic location and building characteristics in addition to the test result. The repository data are available to researchers through a formal data request. And then finally, the residential repository data points are geocoded and feed into the BC Radon map that we went through in the previous slide, which again displays radon summary statistics for different geographic levels. The BCRDR currently contains about 44,000 measurements, representing about 23,000 unique buildings. Of these, around 20,000 have been geocoded and included in the map. This figure compares a map generated with the data collected from that first cross-Canada radon survey to one produced using the BCRDR data. As you can see on the right, our dataset is much more robust and reveals some areas with really high proportions of homes over the threshold, particularly in the southeast of the province. And these weren't visible in the original survey because of limited data. So up until now, we at the BCCDC have been focused on growing the repository, onboarding more data providers, trying to increase awareness that the repository and the map even exist and get people using it. So we haven't yet had a chance to assess whether it is meeting its objectives. When I came onto the project last year, it seemed like a good opportunity to do a formal evaluation for a couple reasons. First, as I said, the repository was just launched in 2021, so it was still relatively new, and we didn't know how well it was operating in practice. And second, the BCCDC has been contracted by Health Canada to support the development of a similar national level radon data repository based on the BCRDR. So anything learned during this evaluation can not only be used to improve our current provincial system, but to inform that potential national system as well. So to guide the evaluation, we used a framework developed by the CDC for evaluating public health surveillance systems. Broadly, this framework includes 4 steps. First, defining the evaluation objectives, including the questions you want to answer and the surveillance attributes that you'll be assessing. Second, identifying and engaging with the stakeholders that will be consulted for data collection and will receive the recommendations. Third, gathering the evidence to evaluate the selected attributes. And fourth, using the findings to develop actionable and realistic recommendations and disseminating the results and lessons learned. So for this evaluation of the BCRDR, we developed 3 objectives. First, to understand the acceptability of the repository from the perspective of the radon data holders who are contributing to the system. Second, to assess whether the data captured in the BCRDR are representative of the real spatial distribution of radon in BC. And third, to describe how stakeholders are using the data from the BCRDR in practice and identify opportunities to improve usefulness. We identified 4 groups of stakeholders that were engaged over the process of the evaluation. These included radon data holders in BC, including all of the testing professionals, researchers, and government agencies that have ever conducted radon testing and hold radon measurements. Researchers and organizations that have made formal requests for the BCRDR data tables. Public health practitioners, government officials, realtors, and other professionals who use the BC Radon map in their work. And members of the public who consult the BC Radon map for information and risk assessment. I should note that these groups are not mutually exclusive, and many data holders are also users of the map, for example, so they may have been consulted in multiple parts of the evaluation. To conduct the evaluation, we took a mixed methods approach. We used qualitative analyses of surveys and interviews with radon data holders, data users, and members of the public to assess the acceptability and usefulness attributes. For the representativeness attribute, we conducted quantitative analyses of the BCRDR data, comparing measurements that were submitted voluntarily and so represent more of a convenience sample to a small subset that were collected by Health Canada using a random sampling approach and can be used as a gold standard. As an additional representativeness analysis, we also assessed the occurrence of over and under sampling in the convenience sample by health service delivery area by comparing the proportion of measurements collected in an HSDA to the proportion of the population that lives there, with the idea being that they should be approximately equal. And now we can get into some results. Beginning with the acceptability of the BCRDR, we found that overall participation rates among radon data holders could be improved, where only 40% of those that were approached agreed to participate. However, the feedback from those currently contributing data was positive. Over 90% said that they had been somewhat or extremely willing to participate in the repository when they were first approached, and the majority would choose to participate again if given the chance. Although several reported some initial concerns surrounding privacy and confidentiality, all felt that the BCCDC had adequately addressed these concerns by developing a comprehensive data sharing agreement that outlined how the data would be used and reassured providers that their data would be protected. Most providers reported no issues with the onboarding process, and several remarked on how helpful the BCCDC staff were in getting everything set up. Overall, they found the process of submitting data to be quick and easy, and many appreciated that there's no special portals or formatting or anything required, and they can submit their data by email in the original spreadsheet form. All felt that the annual frequency of submissions was adequate given the long-term nature of radon testing, and time spent on repository-related activities ranged from about 2 to 15 hours per year, with most providers finding that acceptable. A few did note that it was not a high priority for them, so finding the time to actually do it could be a challenge. But other than time, no other resources were required to participate. In terms of areas for improvement, knowledge on how the data they submit are being used in practice was mixed. All providers were aware of the BC Radon map, but there was a lot more uncertainty surrounding the repository data tables, and a few providers expressed interest in receiving results and deliverables from the BCRDR to get a sense of how their data were being used for research. On to the representativeness of the BCRDR. As I said, the idea was to compare a series of indicators across the convenience and random samples to determine not only if they differ, but if so, by how much. This figure compares the proportion of radon measurements over the remediation threshold in the random and convenience sample data by health service delivery area. And as you can see, the proportions were consistently higher in the convenience sample compared to the random, suggesting that the convenience sample might be biased towards higher exposure homes. This is likely due to self-selection, wherein those with greater awareness of radon or who live in higher risk areas are more motivated to test. And the interior and northern health authorities provide a good illustration of this. These health authorities have the highest proportions of measurements above the remediation threshold across both sample types, which is expected because they're in regions of higher geologic radon potential, according to the map that I showed earlier. You will notice, though, that the magnitude of the difference between the random and convenient samples is quite a bit higher in these health authorities compared to the others, and this is thought to be because of the fact that they're known to be higher risk areas. So there's a lot more knowledge of radon and its health effects, and a lot more testing has been done as a result, which has led to them being overrepresented in the data. We see a similar pattern when looking at the geometric mean radon concentration by HSDA in the random compared to the convenient sample, with the geometric means in the convenient sample exceeding those in the random sample across all HSDAs. These differences were statistically significant, which again reinforces the finding that the data submitted voluntarily to the BCRDR by radon data holders are not representative of the real distribution of radon in the province, and tend to be skewed toward higher measurements. Again, the geometric means were highest in the health authorities with higher underlying geologic radon potential, so the interior and northern regions, and this was seen across both sample types, which is what we would expect. Finally, looking at the occurrence of over and under sampling by HSDA, we compared the proportion of measurements in an HSDA with the proportion of the population that lived there. We found that over half of HSDAs were significantly undersampled, while close to 40% were significantly oversampled. Oversampling was more likely to occur in HSDAs located in regions with high geologic radon potential, while undersampling was predominantly found in lower potential regions. This again makes sense, as radon awareness is generally higher in the high potential regions, and people living in these regions may also be targeted by testing campaigns or other interventions. Individuals living in regions where radon has not been identified as a significant problem, on the other hand, might conclude that they're not at risk, and so they might not seek out testing. Looking finally at the usefulness attribute, we first assessed the usefulness of the BCRDR repository data tables, which, as I mentioned earlier, are available to researchers on request. As of now, we received 6 requests for the repository data, primarily from academic researchers. All of the users of the BCRDR data tables felt that the data were extremely useful for their work, and none reported any concerns about using it. The most common reported use was for research, and 2 users said that the data had been used to inform decision-making or changes to policy and practice. Of these users, both mentioned that the BCRDR data may have contributed to recent changes to the BC building code, wherein all new builds are now required to install radon weapons, as opposed to just those in so-called high-risk radon regions, which was the case previously. Next, we assessed the usefulness of the BC Radon map. We were able to speak with 7 public health practitioners or researchers who used the map in their work, all of whom reported that it was somewhat or extremely useful. The most common use of the map was to assess risk, followed by to increase awareness and to inform action, and 5 out of 7 users said that the map had been used to inform decision-making or changes to policy and practice. Once again, many mentioned the changes to the BC building code. Other reported uses of the map were to identify under-tested areas to target with awareness and testing campaigns, to point to as a trusted source of data when meeting with external stakeholders, and also as a tool to secure approval and funding for radon mitigation projects. Most respondents were somewhat or extremely satisfied with the various characteristics of the map. However, a few felt that the granularity was not sufficient for their needs, and some recalled some initial trouble interpreting the data when they first started using the map. Because of this, several felt that a tutorial would be helpful, and many also expressed a desire for the inclusion of additional data and filters into the map. or example measurements from schools and daycares and workplaces, or filters for the type of dwelling or the presence or absence of a mitigation system. Importantly, nearly half of respondents had some concerns about radon mapping in general and worried that the map might be misleading and used to justify not testing homes in low-risk areas. And interestingly, the results of the public survey that we posted on the BC Radon Map webpage did support this, with several respondents expressing some confusion about whether or not they should test their homes, given that they reside in seemingly low-risk areas. That said, more than 90% of public respondents thought that the map was somewhat or extremely useful for assessing radon risk. Over 70% reported increased knowledge of the health effects of radon after viewing the map, and close to 90% reported increased knowledge of the spatial distribution of indoor radon in BC. The majority of respondents felt that the map was easy to understand, although a few noted that it took them a couple minutes to realize that they could change their filters. Similarly, the interpretation provided was generally considered sufficient. However, a few users wanted more granular data, and others asked for additional information to be included in that pop-up, such as details on cancer rates within the region or a summary of the underlying geology. When asked about specific actions they would take after viewing the map, the most common responses were learning more about radon and getting their home tested for radon. And just 4 people said they wouldn't take any actions as a result of the map. So based on the evaluation, we concluded that the acceptability of the BCRDR was high. Data providers were generally happy to participate in the repository and found the process of submitting data to be quick and easy. And while concerns about confidentiality were common, these were generally resolved by the data sharing agreement. Similarly, the usefulness of the BCRDR was considered high. Both the repository data tables and the BC Radon map were well used by a variety of stakeholders, including academics, public health practitioners, government officials, and members of the public. And uses ranged from simply assessing personal risk all the way up to informing changes to the building codes. On the other hand, representativeness was found to be low, with the BCRDR biased towards higher test results and higher risk regions overrepresented in the data. Using feedback from the evaluation, we formulated a number of recommendations for each attribute that we're currently in the process of implementing. For acceptability, these included increasing data holder participation rates by exploring new ways to recruit unresponsive radon data holders, as well as providing regular updates to contributors on how their data are being used in practice to promote trust and increase motivation to share their data. For representativeness, recommendations included continuing to encourage residential radon testing in BC with a particular focus on regions that were underrepresented in the data, and prioritizing the onboarding of radon data holders in regions with low sample sizes. And for usefulness, recommendations included incorporating additional data and filters into the map wherever possible, simplifying the messaging for lay users, and developing a tutorial to walk users through the features of the map. And I'm happy to report that this last one has already been completed and will be launching on the website soon. In addition to improving the existing BCRDR, the lessons learned from this evaluation can also be used to inform the development of this potential national radon repository that's been proposed by Health Canada to ensure that any system that's developed is as acceptable, representative, and useful as possible. The findings from this evaluation highlighted the importance of a quick and easy data submission process, for example, to minimize the burden of reporting on providers, as well as the need for a robust data sharing agreement to quell any concerns about privacy and confidentiality. Based on the results of our representativeness analysis, it can be expected that a national repository will face similar issues of data being skewed towards higher measurements and oversampling in higher risk areas. Awareness of these biases will allow those managing the repository to target their efforts towards underrepresented regions to increase their sample sizes and thereby improve representativeness. In terms of usefulness, the national repository should strive for data fields to be as complete as possible to allow for broader uses of the data, and should consider including other relevant information, particularly relating to geology and lung cancer. If the data is being mapped, there should be consideration given to the potential harms of presenting radon data in this way, which was raised by several of the users consulted in this evaluation. And finally, any maps developed should be designed with a lay audience in mind, with simplicity and ease of interpretation prioritized. And I'd like to end my talk today by again imploring you to test your home for radon. Not only is it the only way to know if you're at risk, but every test done strengthens our repository and improves the representativeness of our data and the quality of our map. So with that in mind, based on what you've learned during this presentation, I have one last poll for you. Will you A, definitely test your home for radon? B, consult the BC Radon map and test your home if you live in a high-risk area? C, not test your home for radon? Or D, you're ahead of the curve and you have already tested in the past? Lots of results coming in. I'm quite happy to see so many people have already tested. That's a great sign. And almost 30% are planning to test, so that's good news. I see a lot of you are going to consult the map first. We do have to again say that even if the map shows you're in a low risk area, that doesn't necessarily mean your home is low risk. So keep that in mind. And just a couple of you are not going to test. So this is great to see. Thank you. So that's where I'm going to leave it today. I'd like to thank all of the people on this slide for their help with the project. And I am happy to try to take any questions. Thank you.